So, what is anxiety? Anxiety is a response that prepares us to deal with threats in our environment. For instance, if we are walking in the woods and we encounter a bear, anxiety would help us to respond to that potential threat. This is known as the fight or flight response, and it entails a number of physiological changes that take place in our body in order to take instant action to respond to a threat. So, for instance, a lot of chemicals will be pumped into our bodies in order to help us to run away from the bear. In this way, anxiety helps us to protect ourselves from danger, thereby constituting an adaptive response that is vital for our survival. However, anxiety may be activated in situations where the threat is not imminent or not even real. For instance, if we are going to a job interview, the idea of being interviewed may feel threatening, but it is not a threat to our survival. Nonetheless, we react in similar ways to real, potential, or even imagined threats. That's the way we are wired. That's who we are. And it is okay to experience anxiety from time to time. However, if anxiety becomes overwhelming because of its frequency, duration, or intensity, that can have a detrimental effect on the individual. The experience of excessive anxiety has been categorized into a number of so-called disorders. For instance, agoraphobia, panic attacks, post-traumatic stress disorder, obsessive compulsive disorder, social phobia, health anxiety, etc. What is important to remember is that the experience of excessive anxiety can be extremely frightening, exhausting, and debilitating for the individual who experiences it. So, what are the causes of anxiety? Well, most research suggests that excessive anxiety is a result of a combination of factors, a combination of genetic, psychological, and environmental factors. So, to make it clear, the development of excessive anxiety may be a result of having inherited a tendency from our parents to develop anxiety, combined with our psychological ability to deal with anxiety or not, combined with the environmental, combined with the environment in which we grew up. So all these factors may have contributed to different extents to the development of anxiety. Can anxiety be treated? Yes. Research suggests that anxiety can be effectively treated with psychotherapy. There are many different types of psychotherapies. I'm not going to talk about all of them. I'm just going to mention three of them: mindfulness, CBT, and psychodynamic therapy. Now, mindfulness focus on helping people to be in the moment rather than ruminating about the past or worrying about the future. So it provides a number of techniques to help people to be in the moment. It's also focused a lot on acceptance. Then we have cognitive behavioral therapies, CBT, that focus on change, helps people to change their way of thinking, change their way of behaving, which will hopefully reduce the symptoms of anxiety. And then we have psychodynamic therapy, which aims at identifying and assimilating the causes of anxiety. So psychodynamic therapy will explore maybe unconscious processes that may have contributed to the development of anxiety. I hope that you found this information useful. Thank you.